Not pain, not weakness, just a strange, sudden feeling, like the ground isn't as steady as it used to be. You take a step, and something feels off. Your balance shifts. You grab the wall. Maybe you laugh it off. Maybe you tell yourself, I'm just tired. Maybe I didn't sleep well. But what if that moment, right there, was your body trying to warn you? Most people don't realize this, but one of the earliest and most ignored warning signs before a stroke isn't a headache or chest pain, it's instability. That subtle unsteadiness, that slight dizziness, that moment where your legs don't feel fully under your control. It may last seconds or minutes and then disappear like nothing ever happened. And that's exactly why it's so dangerous. Because when it fades, people move on. They don't tell anyone. They don't get checked. They don't connect the dots. But inside the body, something serious may already be happening. Blood flow to the brain may be getting interrupted. Tiny clots may be forming. The signals between your brain and muscles may already be weakening. Just enough to affect your balance, but not enough to alarm you. Yet. And here's the part that makes this even more critical. For many people, this exact symptom shows up hours or even days before a major stroke hits. A stroke that can change everything in seconds. Speech, movement, memory, independence, gone. All because the warning came quietly and was ignored. So if you've ever felt unsteady on your feet for no clear reason, even just once, you need to pay attention to what I'm about to show you. Because in the next few minutes, you'll discover the real reason your balance may be failing. The hidden triggers most doctors don't explain clearly, and the simple signs that can tell you if your body is already at risk. Most people think a stroke comes out of nowhere, sudden, dramatic, impossible to predict. But that's not how it usually works. In many cases, the body gives a warning first, a quiet one, a signal so subtle that it's easy to ignore. And one of the most overlooked signs is this: feeling unsteady on your feet. Not falling, not collapsing, just off balance. Maybe you're walking across the room and suddenly feel like the floor shifted slightly. Maybe your steps don't feel as confident as they used to. You pause, you steady yourself, and within seconds, everything feels normal again. So you ignore it. You tell yourself it's nothing. Maybe you stood up too fast. Maybe you're just tired. Maybe it's age catching up. But what if it's not? That brief moment of instability could be your brain struggling to maintain control. Your balance is not just about your legs. It's controlled by complex signals between your brain, nerves, and inner ear. And when something interrupts those signals, even slightly, your body reacts instantly. That small wobble, it could be the first sign that blood flow to part of your brain isn't normal. Sometimes this happens during what doctors call a transient ischemic attack, often referred to as a mini stroke. It may last only a few seconds or minutes and then completely disappear. That's what makes it dangerous, because once it's gone, people feel relieved. They move on. They don't seek help. But a transient ischemic attack is not harmless. It's a warning, a preview of something much more serious that could follow. The problem is, this symptom doesn't look urgent. There's no pain, no dramatic collapse, just a fleeting imbalance that most people brush off without a second thought. And that's exactly why it gets missed. Your body doesn't always shout when something is wrong. Sometimes it whispers. When that sudden unsteadiness hits, it's not just about your legs or your balance. It starts deep inside your brain. Your brain is like a control center, constantly sending signals to your muscles to keep you upright, stable, and coordinated. Every step you take depends on a smooth flow of oxygen-rich blood reaching critical areas of the brain. especially the part responsible for balance and movement, called the cerebellum. Now imagine what happens when that blood flow is briefly interrupted. It doesn't take minutes, it can happen in seconds. A tiny clot or narrowing in a blood vessel can reduce the oxygen supply just enough to disrupt those signals. Your brain tries to function, but it struggles. The messages sent to your legs and muscles become weak, delayed, or slightly confused. And that's when you feel it, that strange, off-balance sensation. That moment where your body doesn't respond the way it should. In many cases, this is caused by something known as an ischemic stroke, where a blockage prevents blood from reaching parts of the brain. But before a major stroke happens, the body often experiences a temporary version of this, called a transient ischemic attack. During this phase, the blockage is brief. Blood flow returns, symptoms disappear. And that's where people get misled. Because when the dizziness or imbalance fades, it feels like nothing serious happened. You go back to your normal routine, assuming it was just fatigue or dehydration. But inside your brain, that moment was a warning sign. It showed that your blood vessels may already be at risk, that a clot has formed once and could form again, possibly stronger, longer, and more dangerous next time. Think of it like a flickering light before a power outage. The system is unstable. The danger isn't always in the symptom itself, but in what it reveals about what's coming next. Your brain depends on constant, uninterrupted blood flow. Even a short disruption can affect how you move, think, and react. So when your body feels off for no clear reason, it's not random. It's your brain telling you something is not right. That moment of unsteadiness doesn't just appear out of nowhere. In most cases, it's the result of underlying triggers that quietly build up over time, often without any obvious symptoms. Here are 5 hidden factors that can significantly increase your risk of and may already be affecting your balance without you realizing it. This is the #1 cause of strokes. When your blood pressure stays elevated, it puts constant stress on your blood vessels, making them weaker and more prone to blockage or rupture. The danger? Most people don't feel it at all. No pain, no warning, until something serious happens. When blood doesn't flow smoothly, it becomes easier for clots to form. This can reduce oxygen delivery to the brain, even temporarily, causing those brief moments of dizziness or imbalance. Poor circulation often develops gradually due to diet, inactivity, or underlying health conditions. Not drinking enough water can thicken your blood and lower blood volume, making it harder for oxygen to reach your brain efficiently. This can lead to lightheadedness and instability, especially in older adults. It sounds simple, but it's one of the most ignored contributors. Uncontrolled sugar levels damage blood vessels over time, increasing the likelihood of blockages. People with diabetes are at a much higher risk of stroke, often without noticing early signs. Even slight imbalances in sugar levels can affect how your brain and body communicate. Standing up too quickly or issues in your inner ear can cause dizziness. But here's the problem. These symptoms can mask something more serious. Many people assume it's just a balance issue, when in reality, it could be connected to reduced blood flow in the brain. Each of these triggers might seem small on their own, but together, they create the perfect conditions for something much more dangerous. And that brief moment when you feel unsteady, it might be your body revealing that one or more of these risks is already in motion. Recognizing these triggers early isn't just helpful. When it comes to a stroke, time is everything. The faster you recognize the warning signs, the greater the chance of preventing permanent damage. That's why doctors around the world use a simple method called fast stroke test. And today, you need to understand it clearly. But here's something most people don't know. Before the classic signs appear, your body may already show one early signal: loss of balance. So let's break this down in the simplest way possible. F. Face. Look in the mirror or at someone near you. Does one side of the face droop slightly? When smiling, does it look uneven? This could mean the brain isn't controlling facial muscles properly. A. Arms. Raise both arms at the same time. Does one arm drift downward or feel weaker? That imbalance is a major red flag that your brain signals are not reaching your muscles correctly. S. Speech. Try saying a simple sentence out loud. Are your words slurred? Do you feel confused while speaking? Even a slight change in speech clarity can be a serious warning. T. Time. If you notice any of these signs, don't wait. Every second matters. Immediate action can protect your brain from long-term damage. Now here's the critical part most people miss. Add balance to this test. If you suddenly feel dizzy, unsteady, or like you might fall without any clear reason, especially if it happens alongside even one fast symptom, that's a powerful signal you should never ignore, even if the feeling disappears within minutes. Many people make the mistake of waiting to see if it happens again, but by then, it may be too late. A stroke doesn't always come with pain. It often begins quietly, with small disruptions in movement, coordination, and speech. Think of this test as your early warning system. You don't need medical equipment, you don't need training, just awareness. So now you know the signs, you understand the risks, but the most important question is: first, never ignore sudden unsteadiness, dizziness, or any of the warning signs we discussed. Even if it lasts just a few seconds and disappears, treat it seriously. Sit down immediately, stay calm, and avoid walking around until you feel stable again. If the symptom is combined with anything frometh, like slurred speech, arm weakness, or facial drooping, don't wait. Call for emergency help right away. Minutes can make the difference between full recovery and permanent damage. Now let's talk about prevention, because protecting yourself doesn't start tomorrow. It starts today. Your brain depends on proper blood flow, and hydration plays a major role in that. Drink enough water throughout the day, especially if you're older. Dehydration can silently increase your risk. High blood pressure is the biggest risk factor for a stroke. If you haven't checked yours recently, start now. Regular monitoring at home can help you catch problems early. You don't need intense workouts. Simple daily walking improves circulation, strengthens your heart, and supports brain health. Even 20 to 30 minutes a day can make a difference. Reduce excess sugar and processed foods. Focus on vegetables, fruits, and balanced meals that support your blood vessels. Small changes here can significantly lower your long-term risk. If you've ever felt unexplained dizziness or imbalance, get it checked, even if it happened once. Doctors can identify underlying issues before they become dangerous. And here's the truth most people overlook. Prevention isn't about doing one big thing. It's about consistently doing small things right. Your body gives signals. Your job is to listen. Because the difference between reacting too late and acting in time